Hello friends, today I will be talking to you about social egg freezing. I am sure all of you must be reading about this in a lot of newspapers and would have also heard about this from your gynecologist or fertility physician. So who are the women who are recommended to undergo social egg freezing, and what is social egg freezing? This is a procedure wherein we request or recommend women who are between the ages of 34 to 37 and who are not ready for motherhood as yet to undergo freezing of their eggs. Typically, the woman's age should be between 34 to 37 for the best results, and these are the patients who would require just a single procedure to freeze a good number of eggs that would help them complete their family later on when they are ready for motherhood. What is happening in this procedure? So when you meet a fertility physician with a desire to freeze your eggs, initially he or she will recommend a few tests to confirm your ovarian reserve as well as to understand that you are medically fit to undergo the procedure. These tests typically involve the test for AMH, tests for your CBC, that is complete blood count, urine, and your infectious disease screen. Having done that and found out that you are having a good reserve, the physician will then ask you to visit him or her on the second or third day of your periods. Once you visit the physician and he has done an ultrasound to understand what is your antral follicle count, this is basically the number of follicles that are seen in each of your ovary at a resting phase. This typically will give him an understanding of how many eggs he is likely to get once he stimulates you. And this will also help him or her to calculate the dose of injections, the gonadotropins, that he or she will give you for you to form the number of eggs. Once he has obtained this, he will then begin with the injections. These injections need to be taken daily. Of course, you can decide on a time. It is best that you fix a time and take the injections every 24 hours so that they have a good effect. Also, these injections need to be refrigerated. I am sure the clinic will definitely stress on the same to you when you meet the fertility physician. Once the injections are started, they will then call you for a follicular monitoring, which involves doing ultrasounds every alternate days or maybe once in 3 days just to check your response to the gonadotropin stimulation. Your physician may adjust the dosage based on the ultrasound he or she performs and based on your response. What they are ideally looking out for is just approximately 12 to 14 follicles that are growing so that they get enough number of eggs. Once they confirm that there is a good number, they may continue with the same dose. During this time, you may be typically on either 2 injections or sometimes even 3. Women who are having a low reserve and a low AMH may find themselves being injected with a higher dose than the others who have a good ovarian reserve. The dosages typically would be anywhere between 200 international units to even 450 international units. The injections would go on for approximately 9 to 10 days, and once you are ready with a good number of follicles that have come to a mature size of between 18 to 22 millimeters, your doctor will then plan your egg retrieval. In this, he or she will prescribe an HCG injection Or in your case, since you are not going to be carrying a pregnancy to term, they might even think about giving you a GnRH agonist injection. Once this injection is taken, the procedures further are time bound. Your physician will then call you into the clinic approximately 34 to 36 hours to perform the procedure of egg retrieval. Most of the physicians in India prefer to do this procedure under short general anesthesia. The effect of the anesthesia is very short and remains only till the time that the fertility physician's needle is into your ovary. There are no cuts or stitches. With the ultrasound probe, your physician will pass in a long needle through your vagina, which goes directly into your ovaries, and then puncture each follicle. The fluid is then collected under negative pressure into test tubes, which then go into the lab to check for the presence of an egg. Having obtained these eggs, the embryologist will then wait for an hour or two so that the eggs settle, and then the mature eggs, as we call them as M2, are the eggs that are then frozen. Freezing of these eggs is by rapid freezing method, which is termed as vitrification. With this method, what we find is that there is a very rapid cooling and a rapid thawing and very less damage to the eggs, or in fact negligible damage to the eggs. It is because of this that we prefer to do this procedure. Thus, you can be rest assured that if you have 12 eggs frozen with your fertility physician, whenever you are ready for motherhood and when they thaw your eggs, you should be able to retrieve all 12 of them. The procedure will then be followed by administering antibiotics and painkillers to you, which may go on for 4 to 5 days, and typically they may also prescribe some progesterone so that you get your periods on time and your cycle length is maintained. The procedure now is very simple. Complications are very few because you are checked every alternate days or once in 3 days. Dosages are adjusted, and thus you can be rest assured that yes, within 2 weeks' time the procedure is done and you are ready to continue with your career forward. Thank you.